Hi, I'm Dr. Mark. I have a special guest with us today. This is Cheryl. And Cheryl, what are we talking about today?
The topic was about, do feelings last forever? And we realized that there's a lot of responses in that video. So we're going to answer all of those hot burning questions that you guys left in the comments. Let's get started.
Yes.
Number one question is, why there's cavities underneath the feelings if it's already airtight?
That's a good question. So generally, if there is cavities underneath the filling, there are generally three possibilities. So the first possibility is that the dentist may not have removed all the cavities, the decay underneath the filling properly in the first place. The second possibility could be that the filling was not packed tightly enough, which leaves a little bit of void between the filling and the tooth. The third possibility could be simply that with all fillings, especially our modern white filling, it requires a special adhesion, which is like a glue, that holds the filling to the tooth. So over time, the glue will slowly break down, which allows tiny micro gaps to appear and allow bacteria to enter, and then can cause cavities that way. All the filling can simply fall out because of that.
I see. So let's go to the second question, shall we? I think the second question is very related to the first question. The person was saying in the comments is it correct to say that even if I take care of my teeth really well for as long as 10 years, the decay can still occur underneath the fillings?
Yeah, so definitely like what we mentioned before, because of the adhesion, the glue, so no matter how well you keep your teeth clean, you can still break down over time. So you do have to get your filling replaced usually after a while, a period of time. So we do say anywhere from like maybe 3 to 10 years, that type of time frame. The thing is that by keeping your teeth clean, it does prevent decay around the area, which will definitely help your filling to last longer.
So in that situation, with the 3 years to 10 years, why is there such a big lifespan? Why is there such a big difference?
The big difference also depending on the location of the filling as well. So for example, fillings at the very tip of your teeth, like at the very front, just the direction of the forces that may be applied to the filling is different compared to the very back one, where the forces is actually more downwards. So generally, like fillings near the tip or the front of the teeth tend to fail easier compared to the very back ones there. So it also depends on the size of the filling as well. The bigger it is, the more pressure it may sustain, and therefore fail quicker as well.
So the third question is, how would you know when you need to swap the fillings? Do you wait until the filling fails, or whether you have to refill it, I guess, at a certain time?
So oftentimes you don't really know that you have to replace a filling or not, but occasionally there are signs. So sometimes you may feel pain or sensitivity in your teeth. That could be a sign that your filling is failing. Or simply, if it's near the front, you may be able to see these stains between the joining line of the filling and the tooth itself. So generally, if you see that, there is perhaps some micro leakage start to happen, and then the filling may need replaced. But to be sure, we definitely recommend for you to see a dentist for some x-rays, because with the x-rays, we will generally be able to tell that if you need the filling replaced or not.
So would I be able to tell if I come for a regular cleaning and checkup?
Yes, I would say so. Generally, we will take new x-ray records every 12 months. So if there's any changes, we'll definitely pick it up during the appointment there.
Okay, would a regular dental checkup be sufficient? Because you said that regular dental checkup in 6 months' time, you don't get x-ray. Then how would I know if I have a decay if there is no x-ray in 6 months? Does that make sense?
Yeah, that makes sense. For most people, a 6 months time frame, generally, there won't be much changes as long as you maintain your oral hygiene very well. There's usually not a need for every 6 months x-ray unless we see that there is an obvious sign that there could be something suspicious or some decay underneath, then we may take an x-ray then. Otherwise, generally we leave it for a year because you may see no changes at all after 6 months.
The fourth question here is, how about a crown? Then how long does it last with crowns? Does it last forever?
So generally with a crown, for people with very large fillings, okay, we do recommend having a crown rather than just having a very big filling. As we mentioned before, large fillings tend to fail easier compared to the small ones. So a crown is sort of like a helmet for your head, but a helmet for the tooth. It just helps hold the tooth stable and help strengthen it overall. Yeah. So yes, crowns generally last a lot longer than fillings. We normally say about 10 years or more.
I see. So for example, if I have a really small decay in my tooth, then a filling would be sufficient. But if I really have a big decay, then a crown may be
a better,
more suitable, better options.
that's right, it may be a better long-term choice.